release order. Good. Today is 6th?
Yeah.
Good.
Good afternoon, everyone, and thank you for joining us. My name is Luis Diaz. I am a senior policy advisor with the Bureau of Justice Assistance at the Department of Justice. And thank you all for joining. We're honored and excited to be here. Very excited for today's session. We can move it forward if you want. So we're joined today by Whitney Kramer, Troy Hatfield, and Cynthia Mauser. I'm just going to go through today's slides and just talk a little bit about what our role is at BJA. So the Department of Justice Office of Justice Programs, or OJP, is one of the 3 grant-making components of the Department of Justice, the others being the Office of Violence Against Women, OVW, and the Office of Community Oriented Police and Services, COPS. So last year, OJP distributed over $4 billion in grants and cooperative agreements to criminal justice agencies, research groups, and technical assistance organizations across the nation. OJP includes 6 components, including the Bureau of Justice Assistance, which oversees the programs you'll hear about today, the Bureau of Justice Assistance, Bureau of Justice Statistics, the National Institute of Justice, the Office of Victims of Crime, the Office of Juvenile Justice and Delinquency Prevention, OJJDP, and the Office of Sex Offender Sentencing, Monitoring, Apprehending, Registering, and Tracking, otherwise known as SMART. So the BJA is celebrating our 40th anniversary later this year. And so we were created in 1984 to reduce violent crime, create safer communities, and reform our nation's criminal justice system. BJA strengthens the nation's criminal justice system and helps America's state, local, and tribal jurisdictions reduce and prevent crime, reduce recidivism, and promote fair and safe criminal justice systems across the country. BJA focuses its programmatic and policy efforts on providing a wide range of resources, including training and technical assistance to law enforcement, courts, corrections, treatment, reentry, justice information sharing, and community-based partners to address chronic and emerging criminal justice challenges nationwide. BJA is led by our director, Carlton Moore, who was appointed in 2022. So how do we support the field? BJA supports the field in several different ways. BJA funds dozens of programs and thousands of agencies and organizations to enhance community safety. We educate elected leaders, criminal justice practitioners, and the public around best practices, effective policies, and approaches. We equip agencies and practitioners through tools and products that build capacity and enhance outcomes. And we partner with state and local leaders, criminal justice agencies, associations, technical assistance providers, and key stakeholders. And I'll kick it over to Cindy to talk about our work around the CSRC and how we support that initiative.
Thank you, Luis. Hi, everybody. My name is Cynthia Mauser. I'm a senior manager with the Center for Effective Public Policy. So the Community Supervision Resource Center was established by BJA to help community supervision authorities advance faster along the continuum of best and emerging practices. It's intended to help agencies understand where they are on the continuum, define where they want to be, and take steps to get there. The program will collect and share relevant and available resources, develop tools to help agencies operationalize that knowledge to strengthen and make their work more effective, and provide training and technical assistance to agencies in close consultation with BJA. This new resource center will complement the work of the National Reentry Resource Center and the Swift Certain Fair Resource Center. Next slide, please. Some of these objectives, including translating the knowledge in the community supervision field, which is defined as probation, parole, and pretrial supervision of adults, advancing agencies along the continuum of best and evidence-based practices, establishing a resource hub for entities responsible for community supervision, and making available technical training and technical assistance in tools on resources, such as checklists, curricula, assessments, and technology. Next slide. So what is the Community Supervision Resource Center? The Community Supervision Resource Center serves pretrial, probation, and parole supervision agencies and helps them to align their operations with best and evidence-based practices. We all know the community supervision field has made advances over the last several decades. For example, core evidence-based practices based on risk, need, responsivity are widely implemented by supervision agencies. However, agencies need more support to continue improving outcomes for the people served in their communities. Through centralizing critical resources, offering trainings, and providing technical assistance, the Community Supervision Resource Center serves pretrial, probation, and parole supervision agencies and helps them align their operations with best and evidence-based practices. The CSRC is a free resource available to supervision agencies to help strengthen practices, promote successful outcomes, and ensure public safety. Next slide. The CSRC is managed by the Center for Effective Public Policy with funding support and thought partnership from the Bureau of Justice Assistance and with support from the American Probation and Parole Association, the Association of Paroling Authorities International, the National Association of Pretrial Services Agencies, the Center for Justice Innovation, and the Fortune Society. All of our partners serve on our steering committee, along with colleagues from the Council of State Governments and the Swift, Certain, and Fair Resource Center. These experts comprise the brain trust of the CSRC and provide invaluable feedback and perspectives that help guide our work and ensure that we're responsive to all facets of community supervision. Next slide. The main components of the CSRC include a curated web-based library that is a centralized resource for practitioners to obtain the most current research and accessible practice and policy guides. We have curated over 300 publications on a variety of community supervision topics and have developed new resources to address pressing needs and emerging issues. Free webinars and training from leading experts in the field are frequently offered on relevant issues. We strive to deliver informative and useful content, so we value and appreciate feedback on topics of greatest importance to community supervision practitioners and welcome you to let us know how we can best serve the field. To date, we have announced 2 cohort technical assistance opportunities that will be described in more detail shortly. In addition, our website contains an option for community supervision agencies to submit ad hoc TA requests that are reviewed on an ongoing basis. Just like our webinars and trainings, technical assistance is free to successful applicants. An online peer learning community is also in development that will provide a space for community supervision staff to learn and share with colleagues from across the country. Finally, CSRC staff provide technical assistance to BJA Smart Supervision grant recipients. In that capacity, we help sites plan their implementation strategies, intended outcomes, and evaluations. We also support them throughout the grant period by assisting with problem-solving issues that may arise and referring them to helpful resources to aid in implementation efforts. Today, you will hear from one of the fiscal year 23 sites regarding the innovative program implemented in the Massachusetts parole system to strengthen the connection between community supervision and the behavioral health system. I'll now turn it over to my colleague Troy Hatfield, who will describe in greater detail the main CSRC components.
Thanks, Cindy. Again, my name is Troy Hatfield. I'm a senior manager with Center for Effective Public Policy, and I do primarily, my work involves the Community Supervision Resource Center. And like Cindy said, we have a resource library on the website that is there for you. We really strive to find relevant, recent resources from trusted sources that you can use in your work in community supervision. We post publicly available resources from our partners and researchers alike. You can find information there on categories like leadership, race equity, supervision strategies, and a whole lot more. And I'd really encourage you to take a look at those. We're also striving to develop new resources for the field, like Cindy said. We have recently published a self-assessment guide for releasing authorities. We have stories from the field. We have Q&A with practitioners. And our most recent publication was a language guide where you can find words and phrases that affect positive change in community supervision agencies. It's a very useful tool that you can use to help guide some of the language that you're using, not only with clients, but also in your policies and your practices. Additionally, we provide training on a regular basis. We do webinars monthly, and we'll continue on doing that through the next year. And you can find recordings from previous trainings that we have done in the past that center around wellness and responsivity in community supervision. Our future trainings that are coming up, we've got one just in a couple of weeks on August 13th, where we compare and contrast pretrial, probation, and parole. September, we're going to be doing a webinar on post-conviction risk assessments, and in October on employee peer support. And then November and December, we'll be doing rural supervision, some challenges that might be faced providing rural supervision in rural areas, and crime resistance in December. And lastly, that I want to talk a little bit about is the technical assistance. We have offered and are currently providing technical assistance to several different sites that are in charge of parole or releasing authorities. And they are addressing a series of different things that they are wanting to address in their communities. Maybe it's condition setting or violation responses, those types of things. We are just now rolling out and starting to work with sites, probation agencies, to deal with recruitment, retention, and officer wellness strategies. And we'll be offering some TA technical assistance for pretrial agencies in the near future. But it's also a place where you can request technical assistance for a variety of reasons or a variety of things. You can just go online to our website and fill out kind of a little questionnaire that kind of describes what you're looking for, and do that, submit it. We may be able to come out and help and provide that technical assistance. It's all through the Community Supervision Resource Center. On the screen, you see the website. I really encourage you to go and check us out and take a look at it and see what offerings that we have that may be very valuable to you. So as Cindy says, one of the things that CSRC also does is work with our smart supervision sites, and you're getting ready to hear from one now. And I'm going to turn this over to Whitney to talk about some of the great things that they're doing in Massachusetts.
Awesome. Thank you so much, Troy. I really appreciate that intro from both you and Cindy. Thanks so much for having me today. I'm Whitney Kramer. I am the Senior Director of Justice and Health Equity at 4Health Consulting at UMass Chan Medical School, which is a mouthful. I had to take a break there in the middle. And that is we are part of a consulting branch of the medical school here in Massachusetts that provides justice-related oversight and also consultation, in particular healthcare consultation, to a number of state agencies and stakeholders within Massachusetts. So our groups work with a number of different reentry initiatives, our staff, as well as policy development, but are really excited to be here today to talk with you about the work that we're doing with parole in Massachusetts and to be here as a SMART supervision recipient, which we are really excited about. So Community Pathways as a collaboration with the Executive Office of Public Safety and Security, which in Massachusetts is where our Mass Parole Board falls under. And with the support of the Undersecretary of Public Safety, Andy Peck, who has been just really instrumental in bringing us to the table in these conversations and having just really innovative approaches to focusing on resources and providing folks who are incarcerated and also returning to the community resources to help them succeed. And so as a result of many conversations and brainstorming sessions, Community Pathways was developed. And so in Massachusetts, like I said, we are under the Executive Office of Public Safety and Security umbrella, but there are 4 additional units in the parole structure, aside from the parole board member. So we have transitional services, which are the folks who are inside of the facilities, both our sheriff's offices and our state DOC facilities, who are assisting folks with, home plans and identifying them and helping them prepare for their parole hearing that occurs within the institution. We have the field services division, who provide the supervision when folks get the positive parole vote and are out in the field. We have a victim services unit that focuses specifically on victim services hearings, access hearings, and then also will be present for lifer hearings, which happen separately from the institutional hearings. And then the life services unit, which is a special unit focused on those individuals who are serving second degree in Massachusetts, which is life with the possibility of parole. Next slide, please. So we've got some data here from 2022, and we're hoping to get some updated data once parole releases their newest year in review, but just shows that in 2022, over 3,000 hearings were conducted face-to-face, coming out of the COVID pandemic with institutions and having to have board members, again, I know we're coming from a smaller state here in Massachusetts, but still have to travel across across the state, county lines to see folks in their facilities. Over 3,000 of those occurred face-to-face. There was a 14% increase in the number of incarcerated individuals who were released on parole supervision, and about 650 parolees were assisted by field parole officers in accessing and securing transitional or sober housing in 2022. So Community Pathways was born as a result of hearing some of the needs that, in seeing the trends in the data from the staff, and also just, looking at what we were seeing here in Massachusetts. And it's a program that develops channels for the enhanced delivery of care to individuals with substance use disorder and other behavioral health disorders reentering the community. So it really acts as a consultative service, which we'll talk a bit about in a little while here, to assist both the transitional staff and the field staff in providing additional support to individuals who are on parole supervision or preparing for parole supervision. Next slide, please. Thank you. So it involves access to expert consultants, assists with establishing relationships for parole staff to community providers, and it's the ability to maximize resources. And in turn, obviously, we want to improve patient outcomes. So we are utilizing our expert consultation both clinically. So myself, I'm a licensed mental health counselor here in Massachusetts. We were able to hire a second mental health counselor, licensed mental health counselor, just this spring. So she has joined the team and has adjusted quite well. And then we also have a pharmaceutical consultant who is an MOUD expert and provides lots of consultation, which we'll talk a bit about the data and some of the calls that we receive and what those look like. But to especially the field staff as they're reviewing those UAs and looking at different drug interactions or what happens for folks, you know, as they're coming up on these test results. So that has been really helpful. And so in addition to the consultation, we are also really helping to connect parole staff to community providers, both substance use, behavioral health, housing, any and all that are available and that we can connect to. So there's sort of been this longstanding, I think, you know, stigma associated with both sides of the house, right? Community behavioral health providers and also with parole staff. And so what we're really trying to do is be that bridge to demystify both of those agencies for each other. And so what we have been doing is, you know, taking tours of these facilities, bringing the field staff with us, having them sit there, ask questions, answer questions, and have a conversation together to really help maximize resources that are available to staff who are in the community to help get folks connected to the necessary resource. And ultimately, the goal is to increase the tenure for these individuals in the community. Next slide, please. Thank you. So with the support of, oh, whoops, I guess I already went ahead and said this. So exactly, we are trying to maximize resources and in turn improve those patient outcomes. Next slide, please, Troy. Thank you. So with the support of Undersecretary Peck, we were able to get into a partnership with this initiative, and we really looked at this into 3 different phases. So we started out, phase 1 was more policy-based substance use disorder training for all parole board staff. So that was the board, field, transitional staff, folks who, you know, work on the warrant unit, sort of everybody was included in that. And that was really focused on sort of a 101 level training, as we sort of refer to it. So, you know, what substances are out there, and as well as ADA training, which we'll go into in a bit. Phase 2 is the development and implementation of a program with individuals with SUD. So focusing on those individuals on parole who have a substance use disorder and or are on or looking to be prescribed medications for opioid use disorder. And then phase 3 is that community support building. So phase 1, we really broke this up into 2 parts, and we trained the field and we trained the transitional staff and the board sort of separately, just to really tailor each training to their specific needs and to their specific, you know, how it would translate for them in their roles. And so we did an MOUD training, which really helped to provide, I think, information for staff that maybe they weren't aware of in Massachusetts. We're very grateful here that as of last year, I believe, all of our facilities, all houses of correction and our DOC in all security levels offer 3 forms of MOUD. And so folks are induced on that when they get in, if they're not already on it when they arrive. They are assessed to need that, you know, while they're incarcerated, and then before when they are released, they're already on Suboxone, methadone, and in some of our facilities, even Sublocade is offered. So it was really around that, helping the field staff understand, hey, this is happening before folks get out. It should be something that's happening while they're incarcerated still. And then how do we assist them when they're out in the community? What does that look like? How can we provide them with support and resources? And why is this important, right? So we did a lot of training on that. And then we also did training around the Americans with Disabilities Act and how SUD disorders play a role in ADA and what that looks like. And so we were able to talk about the impact of that, provide them with a contact for themselves, for individuals on parole to be able to access. They had questions about ADA and how maybe it was impacting folks as they return to the community and what that was looking like for them as they transitioned back. Next slide, please. Phase 2 is really the bulk of the work, I think would say. And it's really this supportive ongoing phase. And so we, conducted a lit review first off to see what was happening in other areas as it related to parole and parole practices and clinical support while on parole. And then we really broke that down and developed our own sort of wish list, I guess, of what we wanted to happen here in Massachusetts and what we wanted that to look like. And so we developed and implemented this program, focusing really on individuals with substance use disorder and mental health disabilities. And again, those who are on or looking to get on MOUD. In addition to myself, like I said, we have a consultant pharmacist who, really had no experience in this world in law enforcement or corrections. He came from the hospital world, but has a specialization in MOUD and substance use disorders, and has been an excellent addition to the team and has really provided a lot of great consultation, resources, and training to the parole staff since joining the team 2 years ago. And so the field staff can utilize us and support in, sort of whatever they might need under a pharmaceutical or clinical lens. And it's really helped with decreasing the amount of folks who are returning to incarceration as a result of some of these technical violations. So here in Mass, if somebody gets a parole vote and it's positive and it's to a long-term program, and maybe that program isn't the right fit for them and it's not working out and they need to go to a different type of program, maybe a sober home, that involves a change of vote, that involves, making sure that public safety is number one and that everyone is safe in that scenario. And so we've been able to partner with our field parole staff to provide options to get folks into different types of housing, which, in Massachusetts, which I'm sure is very similar for others, housing is a tough nut to crack right now. And so that's been really a big piece of this. But aside from that, also detox. So if somebody is, coming up and they have a urine and they've admitted to using substances, we are able to assist with getting them into detox. If, there's no beds available and the field staff are really at a break where they're not able to find anything else, they reach out to us. We're able to assist and try our best to connect them with additional resources, maybe that they hadn't heard of or haven't been a part of, and provide them with that resource. We've also seen a lot of folks recently. I mean, and a lot, I think that's all right, relative, but, a few phone calls we've received for folks who are elderly and appearing to show signs of dementia upon release from the facilities. And so we've also, been looking to provide resources for geriatric care and what that looks like and how we can get folks into different resources and to different support to help just wrap around them and keep them out in the community. So this has been the majority of the work and really, really great opportunities and experiences we've had in collaborating with the field here with this. Next slide, please. Thank you. And then phase 3, which is the community support building phase, which has included myself as the clinical lead, and then Joe as our pharmacist, assisting with field POs, developing and sustaining those collaborative relationships with community-based MOUD, and we've also included community-based behavioral health providers in that as well. So we really want to help improve communication and demystify roles of both parties. And at first it was tough, I think, in Massachusetts at least. Our parole and our probation agencies are under different branches. And so a lot of folks do a lot of work already and are sort of embedded in our probation and our court systems. We have, many treatment courts, specialty courts here in Massachusetts. And so a lot of community providers are already doing a lot of work with those individuals. And so our first sort of meetings, we were really helping them understand that parole and probation are similar, but they are different, and helping them to sort of see that, there's a person on parole who oversees this area, right? Who has this region. And we'll talk a little bit about how we divide up supervision regions in Massachusetts, but we really wanted that direct contact. So if, you know, I'm the person who oversees Suffolk County, which is where Boston is, and here are the towns that I oversee as the field parole officer, I want to be able to have a face-to-face contact with, you know, Sally Sue and John Smith and those people that are in those community behavioral health centers, MOUD provider spaces, so that I can pick up the phone and say, hey, Sally, how is our buddy, you know, Joe doing? I don't know if he's doing so great. And we want that release signed. We want to be able to understand why that happens and why that's important so that we can share information and make sure that we're providing this person with the services that they need and helping them and ultimately intervening proactively, you know, before it becomes a problem of public safety or an issue of this person, you know, returning to incarceration as a result of, you know, perhaps more serious violations as a result of their behavior. We have expanded to those behavioral health centers, like I said, and so we've been visiting some of our community behavioral health centers here in Massachusetts and have really started to make really good connections with them as well. So this occurs in our 9 regional parole offices. So here in Massachusetts, we've got 9 regional offices in the community across, we've got more counties than that, but some counties are grouped together. And so we, you know, again, I know this is a small state compared to some of you perhaps, but we are able to travel across the different regions and actually have meetings with these individuals, and bringing them into the parole offices has been really great. So after we've done a couple of visits to MOUD providers or to community behavioral health providers, what we'll do is we'll invite those individuals to come into the parole office. And, you know, we know that food is always a good thing. So sometimes we have coffee or bagels or pastries, and we invite them in to share, you know, about the services that they offer, how they can get in touch with them. And then ultimately, officers are able to share, you know, here are some of the challenges we're having with finding therapists or finding a doctor, or, you know, this person didn't make some great choices and we really wanted to provide you with that information beforehand so that you were aware of what this person, you know, was doing or how they were acting in the community. So it's been really great to see those collaborative conversations happen. Our transitional staff, so our staff that are inside of the facilities, they are in all of our facilities across the Commonwealth. And I am remiss to say that I have to change that because we've actually closed one of our DOC state facilities just last month. So I have to change that. We are down to 11 DOC facilities, and then we have 14 sheriff's offices across Massachusetts. So we've got staff across all of those facilities. So why is this important? Why did the undersecretary think that this was something he wanted to, you know, really hang his hat on? And why is this even, you know, effective? We're providing this appropriate treatment responses to individuals. We're providing resources, interventions, and community pathways is really helping to improve positive outcomes and the lives of these individuals. So for some of them, you know, like I mentioned in Massachusetts, we have second-degree life as a sentence. And so some of these individuals who are getting out have not been out in the community for many years, you know, 30, 35, 40 years. And so to have this additional support for not only the field, but for these individuals to assist them in that transition has been really positive. So we're really fortunate about that. Implementation of the Community Pathways program has really helped to seek to improve the lives of individuals on parole and ultimately impact public safety in a positive way. We have individuals who, you know, maybe wouldn't have gone into detox, or, you know, if a bed couldn't have been found, maybe they would have just, you know, gone AWOL. But now we're able to work together to, you know, provide them with some additional support, additional resources. And the staff have been really receptive to that, which we're really, really, really grateful for. And it benefits the parole officers. It supports them as they seek to find additional services. We know how difficult it is to find therapists, to find substance use evaluations, to find just support in the community. And so this provides them and empowers them with this information so that we can help them connect folks to the resources that they need, right? And for those of you who work in law enforcement, you ultimately have become social workers without really wanting to or recognizing, right, when you took on this career, that that's what was going to happen. And so being able to utilize Joe, myself, and other clinicians that we have on the team as that additional support, even just to bounce some ideas off of. Or, you know, we have a case right now that we're trying to assist with where a person didn't get his ID when he released. It was the wrong photo, and ultimately what's occurred as a result of that is that he hasn't been able to get active health insurance, and he's on, you know, HIV medication, which he needs, obviously. And so helping him get that has been a struggle. He's in a program. And so all of these layers are involved with this particular individual, but everyone is at the table. The program staff, you know, are included in the email with the parole staff, who include us in this conversation so that we can provide any additional support or ideas that we have, and ultimately just be in the know so that if there is something that comes up, we can say, oh, hey, what about this for this individual? Have we thought about this? And we're in the process of actually planning a conference call or a Zoom with all parties involved in this in the next week or so that we can have a conversation all together and really help to understand, okay, what could we do differently? What could we do in the future that this person is not gonna not get their medication or not have to wait in the ER 6 hours to just get a med renewal. So it's just one example of, you know, something that we're working on to really help provide folks the right resources, services, and connections to care. Next slide, please. So who benefits from this program? This particular program is really focused on field officers, but ultimately it really impacts public safety, the community, and those individuals who are on parole. So those who have substance use needs and need support around accessing and connecting to resources, have mental health diagnoses and need support around accessing and connecting to those resources, are elderly individuals on parole who are needing support and access to increased resources. We recently received access to our parole board's system that they use to track all their data and all of their individuals. And so it's ultimately going to help with increased data collection and understanding, you know, who are the individuals that we're helping, and are these folks high risk? Are they, you know, at medium risk? Are they at low risk on the LSCMI, which is what our parole folks use? And so how can we even more, you know, look at the data and really understand the folks that are being assisted with this program? And then parole officers are also receiving specialized training in behavioral health to help improve their working relationship with individuals on parole and increase their knowledge and awareness of community resources. Next slide, please. So what are some of the goals of the Community Pathways program? Ultimately, at the top of that list is training. So every month we have been providing a standing day of training for both the field and the transitional staff, as well as offering it to the parole board and office support staff, just so that everyone is aware of the conversation and is, you know, provided some of this knowledge. And so we talk about methods of medication for opioid use disorder, health impacts of incarceration. We've talked about signs and symptoms of mental illness. We've done motivational interviewing. We had a stimulant clinic come in and chat with the folks because that was a need that they were seeing in the community, like just stimulant use, and then finding a detox or a program placement for folks who utilize stimulants is really difficult in Massachusetts. And so offering them some support around that and resources around that. So we are really also, you know, looking at the needs of the field and hearing from them to determine what, you know, training topics are next. Additionally, we want to provide education and connection to community-based MOUD and mental health providers, and then that clinical and pharmaceutical consultation available to field staff as they need it. Next slide, please. So we have the program works by referrals and increased access to supports, establishing and enhancing the relationships between the community providers, connections to community providers, and then increased community tenure and decreased revocations as a result of this service. Next slide, please. And I can provide this information, but additionally, our pharmacist has been developed and shared multiple educational one-pagers on different topics, and some of them include stimulant use disorder, gabapentin. We saw xylazine had a increased use here in Massachusetts, our areas, and so we've tried to get ahead of that. We know that drug trends are just so quick. We tried to get ahead of that and provide that resource to folks before others maybe were seeing such a drastic increase in that. Sublocade was something that was asked about. Designer drugs and gas station drugs are others that we're looking at. So really anything that the field is seeing or that TSU staff is seeing that could be helpful to just have a one-page resource for them. And we have, quite a number. I think Joe has maybe 10 now that he's developed, which is great. So we just have those, and the parole staff have them on their computers as well. It's really helpful. Next slide, please. In terms of areas of consultation, so we are providing consultation on urinalysis testing, and so that may be this person says that they haven't, drank alcohol since 2 weeks ago, but their test came back and this is what I'm getting on this. So can you help me understand why that may occur? Or this person's prescribed this medication and I'm not seeing it show up. So there are a lot of different questions about that. Joe has a wealth of knowledge and he's really helpful with providing them with the sort of really quick response, as we know that these are things that are time sensitive, and so he's able to get that information to them quickly. If he doesn't know the answer, he's able to utilize his resources and look that up, which has been really, really great. So a lot of urinalysis, drug screening questions, but also general health questions, also placement areas of placement, or again, it's I do have resources for this individual who's starting to show signs of dementia, and we're not able to keep him in his home any longer. That unfortunately has no family, so it's we're really starting to develop resource libraries as well. So that's one of them. In addition, we're also looking at intimate partner violence resources, so both for victims and for partners who are the abuser in that case, so that if this is something that needs to be an area of focus for this individual on parole, staff already have availability, resources ready to go, and they can get folks connected and refer them to those services if needed. Next slide, please. Thank you. So since we have received the grant, we are really excited about that and have started to have these monthly trainings as we've been able to expand some of the work we were doing as a result of this opportunity. So since March, we have held trainings monthly, and that has included field and transitional staff. And here are some of the trainings that we've included, but signs and symptoms of mental illness, stimulant use disorder. We did do into K2, so synthetic cannabinoids and the impact of that. We did ADA level 2 training, MOUD training, and then a couple months ago, we actually hosted a reentry simulation for both the field and transitional staff. And we utilized some folks who are part of another reentry initiative that we are in partnership with in Massachusetts to assist us with that. And I think the transitional staff really had positive things to say about it. They do a lot of work behind the wall to assist folks in developing their home plans, understanding what their needs are, what resources they might need when they get out. And so for them, it was really helpful to see how setting them up for success can be really impactful as they continue on in their transition to the community. And if they're not set up in a positive way, that can ultimately be a detriment to them, to public safety, and to everyone involved. So so overall, really positive experience with that reentry simulation that we were able to run with them. And in addition, like I mentioned, we were able to hire a senior clinical evaluator just this spring. And this individual, eventually, we would love to have them start conducting assessments while an individual who is eligible for parole is still incarcerated, to help really determine resources that will assist with successful reentry to the community for that individual. So it would be a tool to assist the parole board in understanding, hey, if you are to give this person a positive parole vote, here are some of the things that would need to be set up for them before they are, able to release. Because based on their institutional history, their support or lack of, other social determinants of health, maybe their medical diagnoses, their, behavioral health diagnoses, here are some of the things that we think would be really helpful and provide them with a good support system and set them up for success in the community. And so, when you're looking at them and you are deciding what to do with their parole opportunity, keep sort of these things in mind. So we're looking forward to getting that person, up and running. Right now, what we're doing to sort of prepare for that is actually observing institutional hearings. So personally, myself, I worked for a while in the Department of Correction as a frontline clinician and administrator. And so I hadn't had the ability to see what this process was like. And so for us to really understand how this works, from sort of start to finish, will be just really instrumental in us being able to provide the correct information to assist with these individuals' successful reentry. So that's sort of where we've started, and we are busy with observing hearings now and just learning a lot about the process and the information that's involved, and all of that the board members get before they see individuals for their parole. So it's been really, really helpful having that experience. Okay. I think that we are at the end of the presentation. So if there are any questions, I'll pause for a few minutes.
I have a question for Cynthia in regards to the resource center and technical assistance.
Okay.
Is there any costs, and are there any costs first off? And is there any like cap on the length of time someone can receive technical assistance at the center?
So all of the opportunities at CSRC are free of charge. There is no cost to the agency, whether that's our trainings, webinars, the resources, or the technical assistance. Right now, the technical assistance, the 2 cohort opportunities that we have released are more of a short-term nature. So our work with releasing authorities has spanned over about the course of about 6 months or so. So we're not currently looking at long-term technical assistance. However, if there are applications that we receive that are ad hoc in nature, we will certainly consider those on a case-by-case basis. And if we're interested in helping out an agency that's submitted that application, we can have those conversations about how long the TA will last.
Thanks.
Absolutely.
Hi there, I have a question. So I was wondering if, or I guess wondering how you all connect with folks that might be working in this area professionally. So I do research in supervision, community supervision, and particularly some overlap with disasters. So think hurricanes, floods, COVID-19, that kind of thing. And I got the information about the webinar in a couple of different places. But yeah, just wondering how you all connect with the experts that you end up meeting with and helping to develop out the program.
Let me make sure I understood that question, because it was a little, the audio was a little muffled. But are you asking how we connect? I think what I heard was that you were asking us how we connect with the folks that we're featuring in our webinars and training and so on. And, you know, that takes a variety of forms. So as I mentioned earlier in the presentation, we have our project partners that consist of the professional associations that represent parole authorities, probation and parole agencies, supervision agencies, pretrial agencies, and so on. And then we're also in attendance at most of their conferences and any others that include community supervision, practitioners or experts and so on. And then, you know, it's sort of the experience of our staff, right? So myself, I have 31 years of experience in community supervision before this position. Troy has 25. So we have a vast depth of experience within the field within our own staff and have made those connections along the way. But you can see the slide that's showing right now is our contact information. So if you want to reach out to either of us, either Troy or myself, we can you know, be in contact and speak with you further about potential opportunities. Great. Any other questions?
Cynthia, could you please give a real quick rundown on those upcoming webinars?
Yes, absolutely. So as Troy mentioned earlier, you can see here on the slide, we have a few really interesting webinars coming up. One is next week, August 13th. And this will be focused on the similarities and differences between the three forms of community supervision: pretrial, probation, and parole supervision. So a contrast, compare and contrast of those three fields. In addition, this one is also going to feature one of our justice policy consultants. So they are people with lived experiences who will also be offering their sort of unique perspective on their experiences through community supervision. Then on September 26th, some of your colleagues at the Council of State Governments are going to be featured in their presentation on post-conviction risk assessment. So some of the work that they have been doing with their standards and particular entities that they're working with. They're also going to feature a practitioner who I believe is from Whitney's neck of the woods from Massachusetts probation. And then on October 16th, we are featuring the Crime and Justice Institute, who have done a lot of work in employee wellness programs. And they are going to be talking specifically about employee peer support programs and some other wellness programs as well, but specifically employee peer support. In addition, then, as Troy mentioned, we don't have the dates confirmed yet for our November and December webinars, but November will be on rural supervision practices, and in December it will be on crime assistance that our partners at the Fortune Society will be delivering. So we encourage you, you can see our website address there. It's communitysupervisioncenter.org. You can register for all the upcoming webinars. You can view any of the recorded prior webinars. You can see all of our resources that we have available. There's links to other agencies and other information. So there's really it's a lot of useful information out there, and we hope to continue to provide information and resources that's really responsive to the needs of the field. All right, well, thank you, everybody. Thanks, Whitney, for highlighting your program in Massachusetts. I have the pleasure of being the TA provider with Whitney and her team. And it's really a great project that's really trying to bridge that gap between community supervision and behavioral health systems. So, you know, I'm thrilled that she was featured here today. And thanks to Troy and to Louise for also participating with me today. And I think that's it for now, Stephen.
Thank you guys very much. Thanks for taking the time out of your day to put on this presentation. I look forward to sharing it with the field, and thanks for all your hard work out there.
Thank you. We appreciate the time.
Take care, everyone.